Hello everyone, I'm Jung, and today I would like to talk about a study with title Perception of Evidence-Based Practice Among Nurses. So what is evidence-based practice? As we know, evidence-based practice or EBE involves integrating the best available evidences with clinical knowledge and expertise while considering patient unique needs and personal preferences. Evidence-based practice is a crucial tool for delivering high-quality care in nursing specialty. Evidence-based practice enables nurses to make optimal decisions and to work from a holistic, patient-centered approach based on experiences. However, the implementation and application of evidence-based practice still have many challenges. Some previous studies show that there's a small percentage of nurses practice based on evidences because those nursing practices are based on experience, tradition, and intuition. The International Council of Nursing emphasized that evidence-based practice is the professional and ethical responsibility of nurses. Therefore, the aims of this study were to describe nurses' practice, attitudes, knowledge, or skill about evidence-based practice, and to identify the related factors to nurses' qualitative on evidence-based practice. The theoretical framework chosen to guide this study was the Rogers theory of diffusion of innovation process. This theory describes 5 stages of innovation decision-making process, including knowledge, persuasion, decision, implementation, and confirmation state, and ultimately lead to the acceptance or rejection of that innovation. Applying this theory in evidence-based practice show that the research resource or evidences represent the innovation, and the research paper or report represent this fusion. Tintinley indicated that the Rogers theory described the behavior of nurses in the process of adopting innovation in the workplace. The descriptive cross-sectional survey design and purposive sampling methods were used. Participants in this study were nurses who working at Bình Định Provincial General Hospital and Cam Ranh Regional General Hospital. The criteria in this study includes participants have degree of associate in nursing or higher, and they had to complete all the required questions. Evidence-based practice questionnaire were used. This questionnaire used 7-point Likert scale to evaluate practice, knowledge or skill, and attitudes toward evidence-based practice. The practice have 6 questions. The knowledge and skill section have 14 sessions. These 2 sessions were divided into 3 levels: low, medium, or high, depending on the mean value. The attitudes include 4 questions, and the attitudes will be positive if the mean value is 4 or higher. The Grandpath answer of evidence-based practice questionnaire was 0.87 for the whole question, 0.85 for practice session, 0.79 for attitudes, and 0.91 for knowledge or skill session. This questionnaire was translated into Vietnamese version and then did the pilot study with 13 nurses to evaluate the Grandpath answer of Vietnamese version question. There were some other questions to collect the participant information, including age, years of nursing experience, the highest degree diploma in nursing, and has participants read or subscribed to any medical or nursing journals. Nurses were asked to give barriers and their feelings when implementing evidence-based practice. Data was analyzed by using SPSS, especially using descriptive statistics, MANOVA, ANOVA with one-variant test, post-hoc test, and the content analysis was used. Among a total of 173 participants, 77 participants had less than and equal to 5 years of nursing experience. 68 participants have 5 to 10 years of experience, and 28 participants had more than 10 years of nursing experience. The findings show that participants have medium score on practice and medium score on knowledge or skill about evidence-based practice, and they have negative attitudes toward evidence-based practice. So in this study, nurses has medium practice and medium knowledge or skill about evidence-based practice. This finding was similar to some previous studies. Others previous study indicated that nurses didn't have enough time for research because they had to spend most of their time to take care of patients. And in this study, nurses had negative attitudes towards evidence-based practice. Some other studies also emphasize that some nurses didn't exactly understand some concepts related to evidence-based practice. And some nurses didn't fully understand the benefits of evidence-based practice. In addition, from this study, 72.8% nurses have not read or subscribed any medical or nursing journals. This may be one of the main reasons affect the perception of evidence-based practice among nurses. According to MANOVA, statistically significant difference were found between 3 groups of years of nursing experience with dependent variables. P-values were 0.001. Next, according to ANOVA, by using one-variant test, statistically significant difference was found between each group of years of nursing experience with each dependent variables, especially p-value less than 0.001 for practice and knowledge or skill, and p-value equal to 0.002 for attitudes. Then, by using post-hoc tests, statistically significant difference for practice, attitudes, and knowledge or skill about evidence-based practice were found between those with more than 10 years of experience and those with less than or equal to 5 years of nursing experience. So the findings show that nurses with more than 10 years experience have higher knowledge, skills, practice, and attitudes than those with less than or equal to 5 years experience. Because nurses with more than 10 years experience have more opportunity to learn from their experience. And they also have more opportunity to improve their soft skills, their specialized knowledge, and even their soft skill during practice in the workplace. That made them feel more self-confident than those with less than or equal to 5 years experience. In addition, participants in this study cited some barriers when implementing evidence-based practice, including nursing shortage, limited knowledge of research, or limited skill of English. So the conclusion of this study were, nurses have medium foreign practice, knowledge of skills, and they have negative attitudes. Number of years of nursing experience affects the perception about evidence-based practice among nurses. There are some barriers when implementing applicating evidence-based practice, includes nursing shortage, limited knowledge of research, and limited skills of English. However, this study also has some limitation. The sample size is small, so in the future research, the sample size should be increased. And participants in this study were just undergraduate nurses. So in future research, we should evaluate perception and compare perception about evidence-based practice between graduate nurses and undergraduate nurses. Thank you so much for your listening.